Welcome back to Cancer Buzz. I'm your host, Summer Johnson. We hope you've been following along with us this week from Washington, D.C. at the ACCC 50th Annual Meeting and Cancer Center Business Summit. It's been a packed week of learning and engagement. Attendees have participated in deep dive sessions on topics from patient navigation to clinical trial diversity to the latest research and payment models. Closing events today included a special message to ACCC members from the White House. The Biden administration sent a delegate to AMCCBS today to provide an update from its end on the partnership between the White House, ACCC, and other organizations to reduce cancer deaths to zero. Dr. Catharine Young is the Assistant Director for the Cancer Moonshot Engagement and Policy at the White House Office of Science and Technology, and she spoke to ACCC members today.
One of the biggest challenges that this nation can take on and tackle together, and we've been really privileged to witness this community rally together unlike ever before. With the Reignited Cancer Moonshot, President Biden lays out a vision of both optimism and urgency and builds upon the achievements that was started back in 2016 with the first Cancer Moonshot when he was then Vice President.
ACCC has long supported the Biden Cancer Moonshot program since its inception, providing support and resources to the White House and developing programming for the oncology community to support its ambitious goals. Dr. Young outlined the priorities for the Moonshot program today.
To organize the effort, President Biden created the first cancer cabinet, bringing together heads of over 20 U.S. agencies and departments to drive progress across the entire federal government. And they are focused on 5 priority actions. The first is to close the screening gap. The second is to understand and address toxic and environmental exposures. The third is to prevent cancers before they begin. The fourth is to drive innovation, to reach patients and communities. And the fifth is to support patients and their caregivers.
She also discussed the progress made by the partnership with ACCC and other key stakeholders in the oncology community to increase screening efforts across the country, particularly for underserved populations.
Early in 2022, the President and First Lady issued a call to action to close the screening gap, rallying the community to jumpstart progress on the 10 million screenings that we lost during the COVID pandemic. Since then, the administration has taken bold actions to close equity gaps and, importantly, facilitate access to these life-saving cancer screenings. And this includes connecting federally qualified health centers to NCI-designated cancer centers with a total of $15 million in funding. In addition, the CDC has issued more than $200 million in grants as part of a commitment of more than $1 billion to advance cancer screenings in every state, U.S. territories, and tribal nations.
ACCC has done much work in these areas, including the development of the Rural Appalachian Lung Cancer Screening Initiative to identify challenges and drastically improve education and lung screening rates in the hardest hit areas of the country. Today, the White House also gave an update on its efforts to reduce environmental toxins.
To drive progress to understand and address toxic and environmental exposures, the EPA has dedicated $1 billion to accelerate cleanup efforts at up to 80 contaminated or so-called Superfund sites and committed $7.4 billion to help states replace lead and service lines. This includes efforts to protect millions of families from forever chemicals and other contaminants that we know increase people's risks of getting certain cancers.
She also briefed the crowd on the federal dollars that have been allocated to cancer research.
To drive new innovation and deliver progress to patients and community, President Biden has established the Advanced Research Projects Agency for Health, or ARPA-H, a new agency that supports transformative biomedical and health breakthroughs. ARPA-H has since awarded more than $500 million to researchers and innovators to drive new ways to prevent, detect, and treat cancer and other diseases. These include projects to develop new tools to detect cancers early, produce innovative approaches to visualize cancer cells during surgery to improve patient outcomes, pursue new treatment approaches, and design devices to deliver treatments directly to cancer cells to treat tumors more effectively.
Finally, Dr. Young reminded AMCCBS attendees that the only way to realize an ambitious goal of eradicating cancer as we know it is to join forces.
By strengthening international collaborations around key oncology elements like clinical trials, data sharing, and basic and translational research, we will accelerate new and innovative treatments for all cancer patients. Working across national boundaries also means sharing best clinical and care practices, developing new ideas and innovations, and reaching more people. Building strong partnerships around the world is really key to making progress towards ending cancer as we know it. Through a focus on equity, on bringing the tools that we have to everyone facing a cancer diagnosis and delivering effective new treatments, we are committed to the goal of cutting the cancer death rate in half, improving the experience of those living and surviving cancer, and achieving a global cancer moonshot, ending cancer as we know it for all.
As we wrap up AMCCBS for 2024, be sure to follow Cancer Buzz on your favorite podcast app to get fresh perspectives on the latest developments and trends in cancer care. We'll be back next week with an interview with ACCC outgoing and incoming presidents, Drs. Ajayi and Barrett. Until next time, for the Cancer Buzz team, this is Summer Johnson.
This show is a resource of the Association of Cancer Care Centers.